Hi, this is the IHF team. We are a medical scientist, an engineer, and a healthcare technologist. This video discusses the donor phenotype classification as an approach to curating a cryopreserved RBC pool and optimizing a refrigerated RBC blood bank inventory.
Hi, this is Elena Butina. As the head of an immunohematology laboratory, I have often been confronted with the challenge of how to best determine the optimal size and antigen composition of the cryopreserved blood unit pool. After years of experience, it became clear that cryopreservation of rare blood types is not a sufficient approach. This led me to the idea of creating a donor phenotype classification and a method to optimize a long-term blood bank inventory.
This presentation covers a developed concept. We will discuss the scientific justification and analytical proof and learn remarkable facts that validate this approach. The donor phenotype classification is associated with a method for optimizing blood banking operations. It implies the analysis of certain antigens in the donor phenotype. The complete donor phenotype classification scheme includes unique, extraordinary, required, universal, and common categories. The well-known universal category is first. Universal phenotype is limited to ABO, Rh, and KEL antigens. RBCs with phenotypes classified as universal possess neither antigens A and B of the ABO system, nor D, big C, and big E of the Rh system, nor K of the KEL system. Phenotypes classified as universal are used for immediate transfusions to recipients whose blood type is not determined, as well as for scheduled transfusions to recipients compatible with ABO and Rh group systems. The recommended standard of care for the universal category is maintaining an unreduced stock of refrigerated RBC units. The required phenotype contains ABO, Rh, and KEL antigens. RBCs classified as required express only one antigen in these pairs. Phenotypes classified as required are in strong demand for both planned and emergency transfusions. The recommended standard of care is maintaining an unreduced stock of refrigerated RBC units. Let's now discuss a fascinating donor phenotype classification type, a unique category. The unique phenotype covers antigens of the ABO, Rh, KEL, KID, Duffy, and MNS blood group systems. Phenotypes classified as unique express only one antigen in these pairs. Such combinations provide compatibility with recipients whose genotypes contain genes encoded with antigens in either homozygous or heterozygous states. In addition, RBCs with phenotypes classified as unique possess neither antigens A and B of the ABO system nor K of the KEL system. The unique category also includes a subset of phenotypes where both the Duffy A and Duffy B antigens are absent. Remarkable facts about the unique category. 80 phenotypes of the unique category are compatible with 99.8% of potential recipients for 16 antigens. These are found in a small number of donors. Therefore, red blood cells classified as unique category are recommended for cryopreservation. What are the phenotyping recommendations to discover donor phenotypes classified as unique? The unique category is based on universal and required phenotypes. IHF recommends phenotyping donors classified as either universal or required for KID, Duffy, and MNS blood groups to discover the phenotypes classified as unique. Now let's discuss the donor phenotypes that include rare combinations of antigens. A phenotype is classified as extraordinary when it lacks an antigen or antigen combination typically found in greater than 99% of the population, and it has an optimal combination of ABO and Rh antigens. The extraordinary category implies the analysis of certain antigens and antigen combinations in the donor phenotype. A rare combination of Rh group antigens, lacking little k, and a rare combination of antigens of the KEL group, and lacking the U antigen of the MNS group. RBCs of these phenotypes are rarely used because they are incompatible with most recipient phenotypes. However, they may be required for alloimmunized patients to the most common antigens. Because of that, the recommended standard of care is to keep 1-2 cryopreserved RBC units for each extraordinary phenotype. Finally, when a phenotype does not belong to any of the above categories, it is classified as common. Hi, this is Gennady, IHF architect. This section presents an analytical justification for the donor phenotype classification using real-world data and the IHF system component. The IHF completed a pilot project at a European research laboratory. The system processed 3 months of operational data from the lab's specialized blood disorder medical unit. Data, demographics. The pilot included 484 donors, 270 men and 214 women aged 21 to 70. Due to the regional population, the donors were all white Europeans. Phenotype. There were 64 universal donors of blood type O negative. The number of antigens, phenotyping result, ranges from 9 to 24. No donors had rare antigen combinations. The pilot system analyzed the donor registry. 15 donor phenotypes were classified as unique. No donor phenotypes were classified into the extraordinary category. For each patient, the system calculates the number of compatible donors. This is how we analytically confirm the following statement. Phenotypes classified as unique are the most compatible with recipient phenotypes with regard to the clinically relevant antigens of the ABO, RH, KEL, KID, Duffy, and MNS blood group systems. 27 pilot patients were assigned to TRG6, making it sufficient in size for analysis. Patients classified as TRG6 require extended phenotype matching. We analyzed the results of the comparison of 327 RBC donors of the appropriate typing level against 27 TRG6 patients, and found substantial differences in the number of recipients compatible with donors classified as unique versus donors classified as common, required, and universal categories. We also compared universal, required, and common categories and found that the average and median number of compatible patients with universal and required donors is significantly higher than for common donors. The donor phenotype classification method is proven to be beneficial to blood banks. Thanks for watching.